To all faculty, staff, and students, President's message: through measures for the prevention of the spread and infection of new coronavirus, COVID-19, Toyohashi University of Technology, President Kazuhiko Terashima. To all faculty, staff, and students, the number of people infected with the new coronavirus COVID-19 is increasing nationwide, especially in Tokyo and Osaka, in the form of a third wave of infection. And the situation is becoming increasingly severe with pressure on medical facilities. In May of this year, our university established the Charter for the Prevention of Infectious Diseases caused by the new coronavirus and has been promoting infection prevention measures. The Charter states, at Toyohashi University of Technology, our ultimate mission is to ensure the health and the safety of students and faculty members, and we will strive to prevent infections by reviewing the management system and environment of the university and promote daily activities based on the principle of maintaining and improving the quality of education and research for students as much as possible. This is our mission statement regarding the prevention of the new coronavirus infection. The following are the three perspectives of the chapter. 1. We respect each other and protect each other's lives. It is important not only to protect ourselves from infection by the new coronavirus infection, but also to prevent ourselves from spreading the infection to those around us. At the university, we will work together to ensure that those who share our activities respect each other and protect each other's lives. 2. We will promote education and research activities based on new lifestyles. There is a possibility that the new coronavirus will spread again, and it is necessary to continue prevention of infection over the medium to long term. The members of the university will aim to promote and develop education, research, and other university activities while practicing the new lifestyle. 3. All members of the university will work together to practice infection prevention. In order to prevent infection, it is necessary for everyone on campus to implement the most appropriate countermeasures in each situation. For this reason, the university will provide the necessary information on infection prevention and countermeasures. And all members of the university will work together to implement these measures. Compared to the time when the charter was established in May, information on the new coronavirus infection and what is necessary to prevent the infection has become more organized. I think everyone has a better understanding of it. The important thing is to make appropriate decisions based on the useful information that you have obtained and put them into practice on your own. Now that the infection is still spreading, I think it is important to go back to the basics. Then I would like to reiterate a particularly important request. Thorough implementation of basic infection prevention measures referred to each prefecture's request. Thoroughly implement. Do not affect yourself. Do not affect others. Please avoid places where the three densities, so-called 3CS, closed space, crowded places, close contact setting, occurred on a daily basis and thoroughly implement basic infection prevention measures, such as wearing masks, washing hands, and disinfecting. In particular, take thorough measures to prevent infection in the 5 situations that increase the risk of infection such as a social gathering that involve eating and drinking. Scene 1. Social gathering with drinking lower the attention due to alcoholic drinking, etc. The effect of alcoholic consumption is to elevate one's mood and lower one's attention, as well as to dull one's hearing and to lead to speaking in a louder voice. It is said that the risk of infection increases when a large number of people stay for a long time in a small space separated by a threshold. Scene 2. Eating and drinking in a large group or for a long time. The risk of infection increases in a group of people with more than 5 people. The risk of infection increases when eating and drinking for a long time, when eating and drinking with entertainment, and when drinking late at night compared to eating for a short time. In addition, the risk of infection increases when eating and drinking with a large number of people, for example, 5 or more people, as they become louder and droplets of saliva spread more often. Scene 3. Conversation without a mask, for example, while eating or drinking at close range. The risk of airborne infection or microdroplet infection increases when people talk at close range without a mask. There are examples of infection during gatherings such as a karaoke. It is also important to be careful when traveling by car or bus. Scene 4. Living together in a small space, such as a private room or common area in a student dormitory. It is said that the risk of infection increases when living together in a small space because the space is closed for a long time. There have been reports of suspected cases of infection in dormitory rooms and common areas such as dormitory and bathrooms. In student dormitories, apartments, and other living spaces, you need to make sure to prevent infection by regularly ventilating about twice an hour, washing your hands, gargling. You have to wear masks if there is more than one person and avoid long conversations. Scene 5. Switch places during lunch breaks and other breaks, changing rooms after exercise, etc. When you change your location, such as when you take a break for work or between classes, the risk of infection may increase due to slackness or minor changes in the environment. There have been cases of suspected infection in break rooms, smoking areas, and locker rooms. In addition, please refrain from entering or leaving places with a high risk of infection, where cluster outbreaks have been reported. For example, areas at night that are likely to be densely populated and to be easily lead to 3CS environment. Please register for the novel coronavirus contact confirmation application (COCOA) and the Toyohashi Novel Coronavirus Notification System and other local governments' own notification system. Please refrain from unnecessary business trips, traveling including returning home and transportations, regardless of the area where infections are prevalent. In particular, please refrain from business trips, travel, and transportation to the Tokyo metropolitan area, Tokyo, Kanagawa, Saitama, and Chiba prefectures, Osaka, and Hokkaido, where the number of infected people has increased significantly. The prevalent areas that require attention will be changed depending on the infection status on weekends. We will change the area depending on the infection status at the end of every weekend. After returning from a prevalent area to the residential area where you attend the university, please study at home or work at home for 1 week and take care measures to reduce the opportunities for contact with other people. Please note that business trips are ordered by the university. When submitting a business trip request to your department head, please take into consideration current situation of the destination areas and other information and submit the request with details of further needs for the trip. Please be sure to consult with your supervisor, academic advisor, extra curriculum activity advisor, and family members, even if you are going on a non-essential trip, including homecoming. If you are going on business trip, travel, including going home, or transportation, be sure to check the infection status and the transportation policy of the prefecture where you are going. Appropriate response and contact with the university when symptoms occur. If there is an unusual change in physical condition or discomfort. 1. Do not go to school. 2. Refrain from meeting people. 3. Be careful of contact with people who live together, each home, student dormitory, etc. If you have any symptom of suspected infection, please contact the University Health Support Center. To all students, precautions for the year-end and New Year holidays and winter vacation. By the deadline of December 17th, Thursday, the university has been conducting a survey on the situation of residents, etc. during the winter holidays. If you don't answer it, please be sure to check and answer as soon as possible. When returning home, be careful based on self-restraint in the prevalent areas mentioned above, especially at home when there are elderly people or high-risk people, those who have chronic diseases such as diabetes, heart disease, cancer patients, etc. Be sure to consult with your family at your hometown after you are returning home. When you return to Toyohashi from your hometown, be sure to wait at home for a week. On January 16th, Saturday, and 17th, Sunday, the Common University Entrance Test will be held nationwide, and our university will be one of the test sites. Approximately 1,300 students will take the test. Therefore, it is necessary for us to prevent infection on the testing and to create an environment where people taking the test can demonstrate their abilities without anxiety. Based on the above, some of you will be returning home, so the classes will start on January 6th, Wednesday. Only remote distance classes will be available until January 14th, Thursday. January 15th, Friday, is no lectures, and face-to-face classes will be also held from January 18th, Monday. From January 5th, Tuesday, the cafeteria, library, information media, infrastructure center, etc. will be available. In addition to previous infection, such as wearing a mask, avoiding 3CS, closed space, crowded places, close contact settings, and observing disinfecting, please make sure to follow the rules and regulations to prevent clusters even if someone is infected. Regarding research in the laboratory, it is desirable that you should study at home as much as possible. But if you need to do research in the laboratory for your research, you need to obtain the permission from the laboratory teacher. Even at that time, please wear a mask and observe the 3 C's: closed space, crowded places, close contact settings, and disinfection. The university will do its utmost to maintain your health and safety. If you have any problems, please consult with your academic advisor, class teacher, student counseling office, doctor at the health support center, public health nurse, nurse or counselor. To all faculty, staff and students, these few weeks will be a critical time for corona prevention. The whole country is working hard to prevent the corona. We will do our best to support you. All staff and students are kindly requested to cooperate with us. These few weeks have been most important time for corona countermeasures. Studying, reading, watching TV and movies, listening to music, playing the piano or musical instrument, seeing arts and crafts, playing sports, eating delicious food, making things, cooking, and talking with friends and family by keeping a special distance or using IT equipment, etc. Let's do when you like to do for relaxing. Let's work together to overcome it. I think it's very painful. Patience and very patience. But we are with you. Let's turn a pinch into an opportunity. Let's do our best. Merry Christmas and a Happy New Year. Thank you very much. Bye-bye.